Let's talk hamstring strains. Hamstring strains occur with athletes most often as they're sprinting or decelerating. And why is this the case? Well, it can be due to a number of different factors, but many of the most common are fatigue, a lack of lumbopelvic control, and most importantly, a lack of eccentric hamstring muscle strength. Eccentric strength is the strength that muscles demonstrate as they're lengthening, which is how the hamstring functions when we're sprinting during the swing phase of sprinting to slow down advancement of the tibia of the shin bone. And of course, if you have a history of a previous hamstring strain, that drastically increases the risk of having another one. Now, if you've had a hamstring strain, the first thing we want to do is avoid irritating it. So we want to avoid stretching early on because that can bother the tissue, and we want to control the pain, the inflammation, and if possible, perform whatever pain-free movement you can, just because that can help speed up recovery down the line by ensuring we still continue to have blood flow to the lower body, we're keeping the muscle active, and then set the stage for being able to load it a little more aggressively as the rehab process continues. Once the pain and the inflammation of the hamstring have gone down, we need to test it to get an idea of what the loading tolerance is of the hamstring. And at Cohen Health and Performance, we use a NORD board. This gives us data to tell us what is the eccentric muscle strength of the injured versus the uninjured hamstring. This is also a great test to be performed on somebody who has had a history of hamstring injuries to get an idea of what is the risk of a future hamstring injury. And also it's a great test for any athlete that plays a sprinting sport where the risk of this type of injury is relatively high, so it can do a lot to help mitigate risk moving forward, because then we can give exercises and recommendations according to what the findings are that an athlete may show us. Now that we have data on our athlete, it's time to implement exercises according to what we find. Typically, we begin with isometric exercises, which are exercises where the muscle is working, but not actually moving. It's a lot less strenuous on the tissue itself. It's a great introduction to loading again, because we want to make sure with the hamstring, we're progressing step by step, because initially the loading tolerance is going to be a little decreased compared to where it's going to be in the future. Once the athlete can tolerate a variety of different isometric exercises well, we then can move on to the eccentric exercises that we have to ultimately get to, because again, that is how the hamstring functions when we are sprinting. Over time, we're going to add more velocity, be a little bit more aggressive with these drills, because the hamstring can actually lose its elastic, explosive properties pretty quickly if we're sedentary for an extended period of time. The final phase of rehab, which we find is often the most difficult for many clinics to implement, is the sport-specific phase. This is the phase when we expose the athlete to many of the forces and as many of the stressors as we can replicate that the athlete will be experiencing in the sport that they return to. This is when we incorporate drills that involve sprinting and jumping and cutting, and oftentimes incorporating all those together into the same drills. It's also when we're going to be trying to dial in the technique with sprinting, for example, to mitigate that injury risk as the athlete returns to play. So if you or someone you know have suffered a hamstring strain, or perhaps you're looking to mitigate your risk of having a hamstring strain moving forward, I hope that you contact us, because there's a ton we can do to reduce your risk moving forward, and we would love to be able to help.